Let's talk about this document, CMS Chapter 15. Let's talk specifically about Section 40, where they reference providers who are able to opt out. And let's talk about why I don't think it's that much of an advantage for physical therapists who want to allow their Medicare beneficiaries to receive what would have been covered services on a cash basis because they believe that the Medicare beneficiary is allowed to, of their own free will, not allow a physical therapist to submit a claim to Medicare. Okay, that was a lot. Let's go to the section and we'll talk about it real quick. So down here, section 40, we're going to jump down to it. This paragraph right here, to me, is the most important element in this argument. So aside from the discussion regarding the mandatory claim submission law, which is separate from this, there are therapists who believe that a patient has the right to refuse to allow that therapist to submit a claim to Medicare. And in so doing, that therapist is able to deliver what would be covered services under the Medicare benefit policy as a cash pay service without submitting a claim. All that aside, it almost doesn't matter because my assumption is if you are a cash-based therapist treating a Medicare beneficiary, you are seeking to charge your full cash rate, which is probably more than the Medicare allowed amount. When we read this paragraph, quote, the only situation in which a non-opt-out physicians, practitioners, or other suppliers are not required to submit claims to Medicare for covered services is where a beneficiary or the beneficiary's legal representative refuses, of his or her own free will, to authorize the submission of a bill to Medicare. However, the limits on what the physician, practitioner, or supplier may collect from the beneficiary continue to apply to charges for the covered services, notwithstanding the absence of a claim to Medicare. So the whole idea in that statement is, even if you believe the patient has the right to refuse to allow you to submit a claim on their behalf to Medicare, that does not allow you to charge your full cash rate, which in most cases is likely higher than the Medicare allowed amount. So rather than even treading on that thin ice, why not just look at where your opportunities are? Why not look at services that are not covered by Medicare, since there are so many of them out there and so many of them benefit the exact patient you're seeking to help?